When community members become volunteer immunization educators, they can broaden the reach of your message and increase overall community support. These volunteers can help inform caregivers of the purpose and benefits of immunization. They can also let the community know when and where sessions will be held. How could your program tap community members as educators? Start by identifying opportunities to partner. Then, support your partners with the information and resources they need. Seek out community volunteers who can serve as educators at immunization sessions, at schools, after religious services, at traditional gatherings, and in collaboration with the media. At immunization sessions, well-trained community volunteers can staff an information table where caregivers stop after their children are vaccinated. These volunteers can reinforce key information about return dates and possible adverse events and respond to any questions or concerns. School systems and teachers can also be engaged to provide information to their students about immunization. School-aged children are the target for some vaccines, and well-informed students may be able to mobilize vaccination in their communities. Parent-teacher association meetings can be a good opportunity for health workers, teachers, or other community educators to provide education about vaccines to the community. In some places, school groups may help track and follow up with children in the community who have missed vaccinations. Traditional and religious community leaders can promote immunization and provide practical information such as session locations and schedules. Provide written information on immunization and other health topics for these leaders to read during community announcements and after religious services. The media can also help inform the community about the availability and impact of immunization services. Health staff and community members can discuss immunization in the local media. For example, a local program could feature a community leader promoting immunization, or parents could share experiences with vaccine-preventable diseases in unimmunized children. Once you've identified who and how partners can help, be sure to provide appropriate training and support materials. First, make sure educators have a good understanding of the benefits and safety of immunization. Here are some examples of key points that community educators can share with caregivers. Vaccines save the lives of millions of children every year by preventing serious illness. Vaccines are safe and effective and have been tested and approved by regulatory authorities, ministries of health, WHO, and UNICEF. It is safe to vaccinate a child who has a mild illness, disability, or malnutrition. Immunization helps caregivers since it is an easier step than treating a sick child with preventable disease. Immunization is free and available at health facilities and outreach sites. Every child has a right to be immunized, and it is the responsibility of parents to immunize their children. Finally, remind caregivers to take the immunization card every time they take their children for a healthcare visit. The type of support materials that are useful will vary by role, but might include question and answer booklets, flip charts, PowerPoint presentations, and links to reliable science-based websites. Finally, be sure your community volunteers have written information about session days, times, and places that they can share with the community. You learned some key ways that community partners can help you educate caregivers. First, identify opportunities to partner, then support your partners with the information and resources they need.